Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor. Thanks for seeing me today.
Good afternoon. I'm here to help. What brings you in today?
I've been having some trouble with my vision for a while now. Things seem blurry, and I find myself squinting a lot, especially when I'm reading or using my phone.
I'm sorry to hear that. When did you start noticing these issues?
It started subtly about 6 months ago, but it's gotten worse recently. Sometimes my eyes feel strained, and I get headaches after a while.
I understand. Have you had any eye injuries or infections recently?
No, not that I can recall. My eyes just feel tired most of the time.
Have you noticed any other symptoms like double vision, difficulty seeing at night, or flashes of light?
No double vision or flashes of light, but I do struggle more to see things clearly at night.
Are you currently taking any medications or do you have any known medical conditions?
No medications, and I don't have any major health issues that I'm aware of.
Do you have a family history of vision problems or eye diseases?
My mother had cataracts when she was in her late 50s, but otherwise, no major issues.
All right. Have you had your vision checked recently, or have you ever worn glasses or contact lenses?
I haven't had an eye exam in years, but I don't wear glasses or contacts.
Okay, let's start with a basic eye examination. I'll check your vision using the eye chart, and we'll measure your eye pressure as well. Based on that, we might need to do further tests.
Sure, that sounds good.
Your visual acuity is indeed reduced, and your intraocular pressure seems elevated. This could be indicative of glaucoma, which is a group of eye conditions that damage the optic nerve and can lead to vision loss. I'll refer you to an ophthalmologist for a comprehensive eye examination and further tests like visual field testing and imaging of the optic nerve.
Oh, that's concerning. What can be done about it?
Treatment for glaucoma usually involves managing the eye pressure to prevent further damage to the optic nerve. This can be done with prescription eye drops, oral medications, laser therapy, or surgery, depending on the severity. The ophthalmologist will recommend the best treatment plan after assessing your condition.
I see. Is there anything I should do in the meantime?
It's important to follow a healthy lifestyle to support your overall eye health. Avoid smoking, maintain a healthy diet rich in antioxidants, and protect your eyes from excessive sunlight by wearing sunglasses. It's also crucial to attend regular eye exams, especially if you have a family history of eye conditions.
Got it. Thanks for your advice, doctor.
You're welcome. Early diagnosis and prompt treatment are essential to slow down or prevent vision loss, so it's good that you've sought medical attention. The ophthalmologist will provide more detailed guidance after further examination.
Thank you. I'll follow up with the ophthalmologist soon.
Great, we'll ensure you receive the best care possible. Let me know if you need anything else.
Will do. Thanks again, doctor.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. Thank you for coming in today. Could you please share with me the symptoms you've been experiencing recently?
Good afternoon, doctor. Thank you for seeing me. Over the past few months, I've been feeling really dizzy and lightheaded, especially when I stand up quickly or after a long period of sitting. I've also noticed that my hands and feet have become swollen quite often, and my energy levels have taken a significant dip. I've always been active, but now I'm finding it hard to keep up with my usual routine.
I understand your concern. When did you first notice these symptoms, and have they been consistent since then?
It all started around 6 months ago, and it's only gotten worse since then. At first, the dizziness wasn't that frequent, but now it's almost every day. The swelling and fatigue also seem to have increased in intensity over time.
Have you noticed any patterns or triggers that seem to make these symptoms worse or better?
Not particularly. The dizziness seems worse in the mornings, but the swelling and fatigue don't seem to follow any specific pattern. Even on days when I'm careful to drink plenty of water and take breaks, they persist.
Have you experienced any other symptoms, like changes in your appetite, unexplained weight changes, or abnormal sweating?
I have lost some weight, around 10 pounds in the past couple of months, despite having my usual appetite. I haven't been sweating more than usual, but I've been feeling colder than normal, even when everyone else seems comfortable.
That's interesting to note. How about changes in your urination or bowel habits?
Yes, I've noticed that I've been urinating more frequently, especially at night. My bowel habits haven't changed much, though.
Thank you for sharing that. It's important to get a full picture. How has your overall health been in recent years? Any significant medical conditions or surgeries?
I have had type 2 diabetes for about 10 years, but it's usually well controlled with diet and medication. I've also had a gallbladder surgery a few years back, but other than that, no major health issues.
How have you been managing your diabetes recently? Any changes in your medications or diet?
I've been on the same medication for a few years, but I did make some changes to my diet recently. I've cut out most carbs and increased my intake of proteins and healthy fats, hoping to lose some weight.
It's good that you've been proactive with your diet, but it's possible these dietary changes could have impacted your blood sugar levels. We'll need to check your levels to see if there's any significant variation. How about your lifestyle? Have you had any recent changes in your daily routine?
Nothing drastic. I work from home and haven't had any major disruptions. I try to maintain a consistent sleep schedule, but I have been feeling more tired recently, so I've been sleeping more than usual.
I see. Given your symptoms, I'd like to run some tests, including a complete blood count, thyroid function tests, and an evaluation of your blood glucose levels to see if they could be causing these issues. We might also need to check for any deficiencies, such as vitamin B12, that can cause similar symptoms.
That sounds like a good idea. I'm really worried about this, especially the dizziness and swelling. I'm hoping we can get to the bottom of it soon.
I understand your concern. We'll make sure to get to the root of this and address your symptoms effectively. In the meantime, try to avoid standing up too quickly to minimize dizziness, and continue to stay hydrated. Let's discuss the test results when they're available and create a comprehensive treatment plan.
Thank you, doctor. I appreciate this, and I'll follow your advice.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We need to transfer Mr. Lewis to the ICU as soon as possible, but the elevator's out of service.
Right? The maintenance team said it'll take a couple of hours to fix. Let's use the service elevator near the West Wing instead.
Good idea. I'll alert the ICU so they can prepare a bed. Can you gather the transport team?
Sure, I'll also make sure they have all the necessary equipment, especially the portable ventilator.
Perfect. I'll meet you at the West Wing once everything's ready.
Sounds good. Let's make it quick and safe.
Now look at question 26.
We've got several key medications on back order, and we're running low on insulin.
We can't afford to run out. Can you call the supplier to expedite the order?
Already tried, but they're facing delays too. Should we look for alternative suppliers?
Yes, we should. Meanwhile, let's check with nearby hospitals if they can spare some stock.
I can reach out to them. Also, let's prioritize insulin for patients who need it the most.
Good idea. I'll inform the nursing team about the situation so they can adjust their orders.
All right, let's make sure we have enough until the next delivery.
Now look at question 27.
Hi, Mrs. Davis. I'm Dr. Collins. I see you're concerned about some side effects from your new medication. Could you tell me more about what you're experiencing?
Hello, doctor. Yes, I've been feeling quite dizzy and nauseous ever since I started taking it. I'm worried it's not agreeing with me.
I'm sorry to hear that. Dizziness and nausea can be common side effects. How long have you been on the medication, and are these symptoms consistent?
It's been about a week, and yes, they don't seem to go away.
Understood. It's possible your body might need more time to adjust, but we should also explore other options. I'd like to run some tests and review your medical history to ensure we're providing the best care.
That sounds good to me. I'd like to feel better soon.
Of course. Let's work together to find the right solution for you.
Now look at question 28.
Good afternoon, Mrs. Perez. I'm the lab technician handling your blood test today. Could you please confirm your name and date of birth?
Good afternoon. Sure, it's Maria Perez, born on August 15th, 1985.
Great, thank you. Your doctor ordered a complete blood count and a blood glucose test. Have you had these tests before?
Yes, I have. I'm not too fond of needles, but I know it's necessary.
I understand. I'll do my best to make it as quick and comfortable as possible. If you could please roll up your sleeve, we'll get started.
All right. Thank you for being gentle about it.
You're welcome. If you feel lightheaded or uncomfortable at any point, just let me know.
Now look at question 29.
I noticed Mr. Johnson has a wound on his leg that's being dressed daily. I'm still learning the best practices for wound care. Could you help me understand the steps?
Certainly. Mr. Johnson's wound is being managed with daily dressings because it's still healing, and we're monitoring it for infection. The most crucial steps are to clean the wound properly and use the right dressing. Are you familiar with the types of dressings?
I have some knowledge about them, but I could use a refresher.
Sure thing. For his wound, we're using a non-stick, absorbent dressing to manage drainage while keeping the wound moist. This helps promote faster healing. The wound needs to be cleaned gently with saline and assessed for signs of infection before applying a new dressing.
Thanks for the clarification. I'll make sure to follow those steps for the next dressing change.
You're welcome. Let me know if you need help with any other aspects of wound care.
Now look at question 30.
I've been noticing some fluctuation in my blood pressure readings recently. I'm wondering if it's something I should be worried about.
Hello. Fluctuations in blood pressure can happen due to various reasons, but it's important to understand the context. Have you been tracking your readings consistently?
I have, and sometimes it's higher in the morning and lower in the evening.
That's not uncommon. Factors like stress, diet, and physical activity can cause fluctuations. It's best to monitor it consistently at the same times each day. Also, avoid caffeine or exercise right before measuring.
I'll keep those points in mind. Should I consider medication if it stays high?
If your readings remain consistently high, I'd recommend seeing a doctor to discuss treatment options. Lifestyle changes like reducing salt intake and increasing physical activity can also help in managing blood pressure.
Thank you for the advice. I'll track my readings more carefully and consult my doctor if needed.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Among the myriad of health issues that challenge global health, few are as deeply interwoven with cultural, societal, and personal threads as maternal health. The complexities surrounding pregnancy and childbirth are not just clinical matters, but are profoundly shaped by socio-economic factors, healthcare systems, and cultural norms. Consider Maria, a 30-year-old woman from a rural village in South America. With her fourth pregnancy, Maria faced complications from the outset. Her access to prenatal care was limited, hindered by the long distance to the nearest clinic and the cost of travel. Additionally, Maria's community had deep-rooted traditions that discouraged hospital births, preferring home deliveries with traditional birth attendants. She managed to get to the hospital for delivery, but the lack of adequate healthcare infrastructure meant her care was delayed, resulting in a postpartum hemorrhage that almost claimed her life. Maria's story reflects the larger narrative of maternal health struggles worldwide. In many low-resource settings, expectant mothers face significant barriers to quality healthcare, leading to preventable complications and deaths. For every mother like Maria, there are countless others who lack access to basic health services during pregnancy, childbirth, and postpartum. In my previous research, I explored the multifaceted challenges of maternal health. It's not just a medical issue, but one deeply rooted in the social determinants of health. Poverty, education, and cultural practices significantly influence maternal outcomes. High-quality prenatal and postnatal care is essential for preventing complications, but its availability often hinges on socioeconomic status. At international health conferences, fellow professionals frequently share their insights on maternal health. A midwife from Tanzania spoke of the impact of providing basic emergency obstetric care in rural clinics, transforming outcomes for mothers and babies. An obstetrician from Canada shared how comprehensive education and community engagement improved maternal health among Indigenous populations. However, personal stories can oversimplify the diverse experiences of mothers globally. Maria's experience, while illustrative, is not representative of all. Maternal health issues vary widely across regions and populations, from obstetric fistula in Africa to high rates of cesarean sections in some developed countries. These differences underline the need for localized and culturally sensitive approaches to maternal health. In the realm of healthcare, personal narratives must align with empirical research. Clinical guidelines and policy recommendations rely on robust data to identify best practices in maternal care. Research into maternal mortality rates, the efficacy of interventions, and the role of midwives informs global health strategies, aiming to reduce preventable deaths. Stories and statistics are both essential in understanding maternal health. Data provides a macro view of trends and gaps, while personal stories give voice to the individual experiences behind the numbers. Together, they reveal the complex interplay of factors influencing maternal outcomes. Maternal health is a shared global challenge. As we strive to reduce maternal mortality and improve care, we must remember the women and families affected. Their stories inspire and guide efforts to build better healthcare systems that meet the needs of every mother, regardless of her circumstances. In medicine, the art of storytelling, combined with scientific research, creates a holistic understanding of health issues. For maternal health, this approach ensures that women like Maria remain at the forefront of healthcare initiatives, inspiring a future where every woman receives the care she deserves.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon. My name is Dr. Ryan Edwards. I'm a gastroenterologist at the Riverside Medical Center, and today I will be discussing an important topic that affects millions worldwide: inflammatory bowel disease, or IBD. While I'm not an epidemiologist, my work in gastroenterology has made me well acquainted with this condition, which requires a multidisciplinary approach for effective management. So, what exactly is IBD? IBD is an umbrella term primarily comprising two major disorders: Crohn's disease and ulcerative colitis. Both involve chronic inflammation of the gastrointestinal tract, but differ in their manifestation. Crohn's disease can affect any part of the gastrointestinal tract, from the mouth to the anus, often in a patchy pattern, In contrast, ulcerative colitis usually impacts the colon and rectum in a continuous manner. Why is understanding IBD crucial? IBD not only imposes a heavy burden on patients due to its chronic nature, but it also significantly impacts healthcare systems globally due to the costs associated with treatment and hospitalizations. Symptoms like abdominal pain, diarrhea, weight loss, and fatigue can severely affect a person's quality of life, making early diagnosis and effective management vital. A frequently asked question is, how is IBD different from other gastrointestinal conditions like irritable bowel syndrome, IBS? While IBS is a functional disorder without visible signs of disease in the gastrointestinal tract, IBD involves actual inflammation that can be observed through endoscopy or imaging tests. This inflammation can lead to complications like strictures, fistulas, and even an increased risk of colon cancer in the long term. What causes IBD? Although the exact cause remains unknown, it is generally understood to result from a combination of genetic and environmental factors that lead to an abnormal immune response. Family history, smoking, diet, and gut microbiota imbalances are considered contributing factors. The exact trigger is still under research, but what is clear is that the immune system mistakenly attacks the gastrointestinal tract, leading to chronic inflammation. The treatment of IBD has advanced significantly in recent years. Management typically involves medication to reduce inflammation and maintain remission. Common drugs include aminosalicylates, corticosteroids, immunomodulators, and biologic therapies. In severe cases, surgical intervention may be required, particularly for complications or when the disease does not respond to medical therapy. Lifestyle adjustments like diet changes and stress management also play a role in treatment. Research is ongoing in several areas, including identifying specific genetic markers to predict disease susceptibility and progression, understanding the role of the gut microbiome, and developing more targeted therapies. One exciting area is the development of personalized medicine, where treatment is tailored to an individual's genetic makeup, potentially leading to better outcomes. The societal cost of IBD is significant. Beyond the direct healthcare costs, the impact on productivity and quality of life can be substantial. Patients often have to deal with work absences, frequent doctor visits, and the side effects of long-term medication. Hence, comprehensive care that includes psychological support, dietary advice, and patient education is crucial. IBD poses significant challenges, but growing awareness, advances in research, and improved treatment options offer hope. As healthcare professionals and community members, we must support those affected by this condition, advocating for better research funding and fostering understanding to reduce stigma.